Hi guys, this video is about astigmatism. So what is astigmatism? This is a refractive error with differing refraction in meridians. So refraction varies in different meridians. There can be horizontal meridian and vertical meridian, and there are different refractions in different meridians. So here the parallel rays do not converge to a single focus. So we know that if this is the lens, the parallel rays should come and focus in a single point. But since different meridians having different refraction, they will not converge in a single focus. Instead, they form focal lines. So we can see two focal lines instead of a single converging point. And therefore we can see blurred or distorted vision at all distances because there is vertical and horizontal meridians giving different refraction. So in every distance, whether it is at near distant or far distant, we can see blurred and distorted vision. Now coming to the theological classification. Astigmatism can be due to corneal cause, lenticular cause or retinal cause. So corneal cause means it is due to the abnormality in curvature of the cornea, like in keratoconus or congenital toric curvature or corneal scarring. In this condition, there will be abnormality in the curvature of cornea and that causes astigmatism. Then it can be due to lens problem or lenticular problem, which can be due to the curvatural problem in the lens, that is lenticonus, or positional problem, that is subluxation, or index problem having variable refractive index. So lenticonus, subluxation or variable refractive index can cause lenticular abnormality causing astigmatism. Can also be due to retinal cause, which is rare, and this is mainly due to oblique macula. So the causes of astigmatism can be abnormalities in cornea, keratoconus, abnormalities in lens, lenticonus, subluxation, and rarely in retina. Now coming to the clinical features of astigmatism. So we told that there is blurred vision for near and far objects. So both vision, distant and near vision, will get blurred. Okay, then there can be asthenopia. There will be eye strain, headache, watering from the eyes, and then there can be distortion of the objects. There can be elongation of the object. A person looking at the graph paper will not see correct squares. They will see elongated or distorted objects. So blurred vision for both near and far vision, asthenopia and distortion, that is elongation. Then the signs are, look through the retinoscope, we will get different powers in two meridians. So the person will have a cylindrical power. Then look for the keratometry, and there we can find out the corneal cause, whether it is due to keratoconus or corneal scarring, if any can be found out by keratometry. Then to the ophthalmoscopy, where we can find oval or tilted disc. So first we have to do the retinoscopy to calculate the power in two meridians. We will get a cylindrical power. Keratometry to find out the corneal cause, and ophthalmoscopy to find out the oval disc or tilted disc. Now coming to the clinical classification of astigmatism. So clinical classification can be regular astigmatism, irregular astigmatism, and based on the focus. So regular astigmatism means it is the refraction power changes uniformly from one meridian to another meridian. So the refractory power changes uniformly from one meridian to another meridian, and the meridians are at 90 degree. So the horizontal meridian and the vertical meridian are at 90 degree, and there the refractory power changes uniformly from one meridian to another. So here in regular astigmatism, there is with the rule astigmatism, against the rule astigmatism, and oblique one. So with the rule astigmatism means here the vertical meridian is steeper or more curved than the horizontal meridian. In against the rule of astigmatism, the horizontal meridian is more steeper than the vertical meridian. So this is seen in young age. With the rule is seen in young age where the vertical meridian is steeper, and against the rule is seen in old age where the horizontal meridian is steeper. And this with the rule is corrected by concave cylindrical lens at 180 degree or convex lens at 90 degree. Okay, so this can be corrected by concave cylindrical lens at 180 degree or convex lenses 90 degree. Now what is oblique? Oblique means the meridians are at right angle. They are at 90 degree but not horizontal or vertical. Here it can be at 45 degree or 135 degree. Combining they will form a right angle, but it is not horizontal or vertical. Coming to irregular astigmatism, here the meridians are not at 90 degree. So regular astigmatism means the meridian were at 90 degree and the refractory power changes uniformly from one meridian to another. But here they are not at 90 degree and they are seen in scars and keratoconus. Coming to based on focus, that is in relation to retina, there can be simple, compound and mixed astigmatism. So simple astigmatism means one meridian focuses on the retina while the other meridian will not focus on the retina. It can be either in front or in the back. That can be myopic or hypermetropic. So one will be on the retina and other can be myopic or hypermetropic. That is simple type of astigmatism. Compound means both are either in front or behind. So both are myopic or both are hypermetropic. Both the meridians focus in front or both the meridians focus behind. Then mixed means one is myopic and the other is hypermetropic. Okay, so simple means one is on the retina, other one is myopic or hypermetropic. Compound means both are myopic or both are hypermetropic, and mixed means one is myopic and the other one is hypermetropic. Now coming to the treatment option, optical and surgical are available. In optical we will give cylindrical spectacles, and also in contact lenses we will give soft toric or RGP. What is RGP? Rigid gas permeable lenses, mainly for high and irregular astigmatism like keratoconus. So cylindrical spectacles and contact lenses can be soft toric contact lenses or rigid gas permeable lenses. Coming to the surgical treatment, can be corneal or lenticular, similar to myopia and hypermetropia. If it is corneal, we can do AK. What is AK? Astigmatis keratomy. So AK and LRI, that is limbal relaxing incision. So we can do astigmatic keratomy, limbal relaxing incision, and LASIK and SMILE. Then if it is lenticular correction, that is we are using toric IOLs during the cataract surgery. If it was myopia and hypermetropia, we use phakic IOL. In astigmatism, we will use toric IOL and they are used using cataract surgery. Summarize the astigmatism, that is definition. It is a refractive error in differing refraction in meridians. So refraction varies in different meridians. We can see two focal lines instead of a single converging point. There is corneal course, lenticular course and retinal course. Clinical classification is regular astigmatism, that is with the rule and against the rule. Then irregular astigmatism where the meridians is not at 90 degree, and based on the focus it can be simple, compound or mixed. Clinical features, that is symptoms and signs. There can be blurred vision, asthenopia and distortion. Signs include in retinoscopy different power, keratometry, corneal course can be found out, and ophthalmoscopy we can see optical disc, oval disc. And treatment options include optical and surgical where we can give cylindrical spectacles, soft toric or rigid gas permeable contact lenses, and in surgical ones we can do corneal operations like astigmatic keratomy and limbal relaxing incision, and lenticular ones like giving toric IOL during cataract surgery. So this was all about astigmatism. Hope it was useful. Thank you.